Chicago is Senator Barack Obama's chief economic advisor, Austin Goolsbee, and from Arlington, Virginia, McCain economic advisor, Douglas Holtz-Eakin. Gentlemen, good to see both of you this morning. I know that you haven't seen it. We talked about this off camera. In the New York Times today, there's a joint editorial features Joseph Stiglitz, 2001 Nobel Prize winner for economics, Glenn Hubbard, who was the chair of the President's Council of Economic Advisors back in the early part of the Bush administration. They pose a couple of questions that they'd like the candidates to answer, so I thought I'd pose those to you this morning. First one comes from Stiglitz, who's pretty pessimistic about this economic bailout, the Wall Street bailout. Says, when this bailout fails, will your candidate propose a new one? How big should it be? Douglas, you want to handle that one first?
Well, I mean, first of all, we got to see how this plays out. To be honest, they haven't even begun implementing the purchases. But I think the real key will be to make sure that there's a strong foundation of actual economic growth underneath the financial sector. We're not going to cure these problems unless we create jobs in America, put people in the ability to make the payments on their mortgages, and get the housing market fixed up. That's the key, and that's what John McCain would focus on.
Austin, if this bailout fails, would your candidate propose another one? How big would it be?
Well, look, you can't answer that because you don't know what's happened. As Doug said, they haven't even started buying up securities, and they won't until November. But this is a crisis. There's no question about that. You got people's life savings at risk. You got millions of people at risk of losing their jobs. If this thing did not work, then absolutely Barack Obama would be for moving on to the next thing to restore the confidence in our markets.
And do you have any idea what you would do, what the next thing would be?
Well, look, it depends. If this thing failed, this is a pure hypothetical. It would depend on what form it would take. What Obama has concentrated on from the outset is calling for a housing program, calling for additional stimulus, and he's really been, if this were a movie, Obama has sort of been the steady hand in the storm, and McCain has been the storm. So what we certainly don't want to do is compound the uncertainties of the market by flipping from position to position.
And what I'd really like to do in this segment, gentlemen, if I could, is get away from the name calling, stick to the facts and the plans here. Other question comes from Glenn Hubbard. And Doug, let me get you to take this one. Do we need more regulation, or is it a problem that the current regulation is poorly focused? What would your candidate do in terms of regulation?
A little bit of both. I mean, quite frankly, we have a system in which the same economic transaction is regulated differently depending on where it occurs, and that doesn't make much sense. So the first thing you have to do is make sure that you get a uniform set of regulations so that you face the same consequences regardless of where you undertake a trade. And in the process, we could get rid of a bit of the alphabet soup of regulatory agencies and clean it up. So John McCain is committed to finding the facts and working in a bipartisan fashion to get effective financial regulation for the 21st century.
Austin, more regulation or just better focus the current regulation?
We need more, clearly more robust oversight. That's one of the critical problems that caused the situation we're in. And Senator Obama has been talking about the need for more oversight and regulation for more than a year.
All right. Got to ask you this question, Douglas. Senator McCain, to help pay for his health care plan, wants to cut Medicare and Medicaid. What would he cut?
That's a Wall Street Journal article that I think mischaracterized the plan itself. There's an enormous potential to lower the cost of health care in America. The research indicates that we can provide better care at lower cost if we focus on prevention, treat chronic diseases using the best practices that are available. And Medicare is a great place to start. Those seniors deserve to get the benefits they're currently promised, but not have their premiums go up so fast. And that's what he promises in his health care plan. Right, let's take advantage of the opportunity to pay for coordinated care, pay for a medical home, get prevention, treat the chronic disease, and lower the overall health care bill.
Right. And Austin, in terms of, you know, the amount of money that the federal government is taking on, added deficits, added debt, people are wondering if the presidential candidates are going to be able to make good on some of their campaign promises. With the extra debt load that this federal government has taken on, will you be able to afford your health care plan, which costs out, by some estimates, at about $65 billion?
Yes, look, Senator Obama's been quite clear as he's gone through with the health plan of how it would be paid for. And as Senator Obama says, you can't afford not to deal with the health care crisis. Obama and Senator McCain's visions are completely different on the health care system, where Obama's putting the focus on ending the discrimination against people that are already sick and getting the cost down, where Senator McCain's version of the health plan is going to involve giving you a credit, taxing your health care benefits, and pushing you into the individual market.
Do you want to respond to that quickly, Douglas, since he took a shot at you?
Well, I mean, that's a complete mischaracterization of the health care plan. John McCain will, in fact, give everyone $5,000, every family in America, toward their health insurance costs, and he'll deliver a fairer system, one where you'll get assistance regardless of your income level, regardless of whether you get your insurance from your employer or not, and indeed, even if you're uninsured. So that'll take 25 to 30 million people out of the ranks of the uninsured and give them a chance to get better access to care.
Now, it's great that when we keep the name calling to a minimum here, we actually get some facts out there for the American people to be able to mull over.